Welcome to our event today, Social Innovation and Community Solutions for a New War on Poverty. We're very pleased to have you in the room with us today, and also as part of our virtual audience out there with C-SPAN and online at newamerica.net. We have a significant audience, we think, from California this morning, where Maurice works, a bunch of his colleagues. So good morning to all of you out there in California as well. I'm Reed Kramer. I direct the asset building program here at the New America Foundation. And in this program, we explore innovations in social development and economic opportunity, especially in ways that promote savings and building up of assets and resources for families over time. Our work is informed by the basic insight that social development isn't assured at a particular moment, but rather unfolds over time as part of a long-term process. And this means we need to be on the lookout for policies and programs and support structures that can help families move forward in their lives productively. This insight's particularly relevant when thinking about issues of poverty and helping families meet their challenges that they face on an ongoing basis. Of course, income matters, and being able to access support structures that kick in when there's an unexpected event or there's a long-term disability are very important to this process. They have to be part of the solution. This means that we do constantly are concerned about the state of our safety net. It's very important that we have a strong safety net in the policy arena to help families. I think historically we've identified that it has some holes in it. Particularly right now, it looks like the safety net is fraying further. This is a problem that I think needs to be addressed. We need to be strengthening the safety net during these hard economic times. And I think one way to do this is to make sure that it's a safety net that has springs in it, that actually can propel people forward in their lives. And so I think that's where the asset building framework can hold promise and help inform the thinking about interventions that can be successful. Looking back at how we've approached poverty issues in the past in this country, I think we can all recognize that it hasn't been easy. It's been very challenging. We've had some successes. We've had some failures. But we also know that we've got limited resources, so we constantly need to be on the lookout for innovations that work and that are effective and that are cost-effective, given our resource constraints. So in that spirit, we're very pleased to feature Maurice Lim Miller today, who is going to be sharing his perspective on this search for social innovation and community solutions for a new war on poverty. He's going to tell us about his work with the Family Independence Initiative, which is based out in Oakland, California. And it's a very novel intervention that's really demonstrating real results. So very exciting. He's been appointed by President Obama to the new White House Council for Community Solutions. And he's already had a long and kind of distinguished career working with low-income and low-resource families. So this is his next, current iteration of his work. I think at this point it's fair to say that he's a social entrepreneur. I mean, he's taking ideas, he's trying to make them work, collaborating with families in the community to develop and scale an innovative anti-poverty approach. The families actually gather together to identify ways to promote economic mobility. There's collective engagement. There's a way that they decide to allocate their own resources. It's an impactful approach, it appears, and it's also costing a lot less than the way we've done it in the past. So it's certainly something to take note of. In a lot of ways, it tips over the apple cart of how we've done case management in the past. And And I think a lot of social work schools really should be taking note of this process. I think some are, some aren't. I think some have pushed back forcefully. They've taken issue with Maurice's approach. Others have applauded the effort. But I think at this point it's helpful to have an engaged discussion about what the experiences have been and what its potential is and what the policy implications are. So he's going to tell us a little bit about his triumphs and tribulations, who he's made angry and pissed off, and who's applauded his work, who's wanted to learn more. So we're looking forward to that because we're not here to fight. We're here to engage in a discussion and really begin exploring the policy implications. And in doing that, we're going to be joined by some distinguished commentators who we're fortunate to have with us. Marta Urquilla is a senior policy advisor to the White House Domestic Policy Council's Office of Social Innovation and Civic Participation. She's filling in for her colleague Sonal Shah, but Marta has been very much at the forefront of a lot of this work, looking for innovative programs that work in low-income communities. And she's played a big role in the Obama administration's approach, ongoing efforts to capture this innovation and replicate it. The Obama administration's put some money behind this effort in the Social Innovation Fund, but I think more importantly, they're very much committed in this effort to demonstration and observation and replication. So it's an important effort that I think we're going to learn more about. And then Mark Greenberg is Deputy, let me get this right, Assistant Secretary for Policy, but in the Administration for Children and Families at HHS. I think the initial invitation went out saying he almost ran all of HHS, and as you know, it's a big agency. But Mark is really longtime promoter of innovative anti-poverty work. He's just one of the people that is one of the most thoughtful people I know who is looking at these issues, looking into poverty programs, what works, and how to improve them. So very pleased to have him here, and he's one of the ones that I'm just really thankful is in government digging into these issues. So we'll hear from Mark. Also wanted to note we're releasing 2 papers today that are part of this work. They're available on our website, newamerica.net. You've been able to pick them up on your way in or can on your way out. One is an essay by Maurice, which is going to offer some of his perspective on launching the initiative and overcoming some of the obstacles that were encountered. The second is by my colleagues, Ann Stuhldreher and Rourke O'Brien at the New America Foundation, who are exploring the policy implications of the lessons learned from this experience. So it's an important piece. And Ann is actually a fabulous innovator in her own right. She's really a policy entrepreneur, and she's incubated a number of ideas that about helping families access financial services and helping families increase their savings and assets and build wealth over time. She's been active in California and at the national level, this is a significant piece. We're pleased to work with her, and she's actually collaborated with Maurice over the years too. So very committed to learning about the experience and how it informs the broader policy discussion. And her co-author, Rourke O'Brien, is our colleague here, another bright mind and rising star. Who's a research fellow here. He's done a lot of work innovating some policy thinking around reforming public assistance programs to make sure that their rules don't discourage savings, but rather encourage it. He's completing his doctoral studies at Princeton, and he's a co-author of a new book coming out with Catherine Newman called Taxing the Poor, that's actually soon to be released, and we're going to have a book event with Catherine and Mark and Rourke, Catherine and Rourke at the end of March, so look for that. Okay, so that's the introduction, and let's bring Maurice up here to present for 15 minutes, then Mark and Marta will give comments, and we'll have an engaged discussion with all of you. So help me welcome Maurice Lim Miller to the podium here. Thank you.
Hello. Good morning. Thank you for having me. It's really nice to be here. See some people that I know, and I appreciate that. Reed, thank you very much, and a lot of thanks to New America Foundation. It's been really great, except that your weather got really cold, and I just flew in. Anyway, so this talk is really about presenting what we think is maybe what we'd call maybe a third way of addressing poverty. And the way to give you a picture of that kind of takes me back to a cartoon I saw probably over a decade ago, which depicted these two men looking over the water, and out in the water there was this other man that was drowning, and he was waving. It's like trying to get some help, and the man standing to the right was yelling out, "See, you should have worked harder and learned how to swim." And the man standing to the left basically says, hold on, we're really designing a program to help you. So my story is that there actually is a third alternative, and that what we would see in this cartoon in this next iteration is that man out in the water yelling back to these two guys is, give me your boat and I'll paddle to the shore that I think really will help me and my family the most. So this talk is really about the boat and who should be paddling. My story, which is a personal story, starts back with my mother. So she was Mexican, third grade education, 2 kids. My sister was a lot older than me, 6 years older than me. She came to San Jose, California to build a new life for both her kids. And she had to work 2 jobs, long hours. My sister, being new in the country, got in with this abusive Italian guy that got her pregnant at 16 and pulled her out of the house and took her to New York. And my mother was devastated. Here she came to America to really build a new life for her kids and almost immediately lost one. So then she goes to me and she says, nunca. It's like, Mauricio, this is not going to happen again. And so she spent the rest of her short life getting me into college. I went through Berkeley. I became an engineer to do what my mother told me I was supposed to do, which was really take care of everybody else. After I lost my mother and watching my sister in this other relationship, I felt that the price that we had to pay to get one kid out was really too high. So I left engineering and I started working in a nonprofit. My first job was training gang kids how to do construction, because I knew how to do construction, and so that they could get out of the gangs, because most of them really wanted to be out of there. And what ended up happening is I ended up running this organization called Asian Neighborhood Design, which was a large CDC, got recognized by Clinton and a bunch of other folks. And we were considered one of the best in the country. And after a while, though, I was really wondering whether we were having an impact. About 10 or 15 years into my work, I started seeing the kids of the first kids I had trained coming back into my system. And I knew the families. I knew everybody wasn't destabilized. But they were kind of like my mother. They weren't able to keep all of their kids out of trouble and out of crisis. And so what I was seeing is this cycle happening that I had seen in my family. And so I start questioning my work, actually, when we were getting all these accolades. And somewhere along the line, around 1999, 2000, I get a call from Jerry Brown. So Jerry Brown's now governor of California. And at the time, he was mayor of Oakland. And he was calling me saying that I was on a board of the Private Institute Council. We were going to get $10.2 million, and he was mad. And you'd think most mayors would be pretty happy when $10.2 million might be coming to their city. And he's over there, have you looked at the proposal and da-da-da? So I get the proposal, I go to the budget page, and sure enough, to spend $10.2 million, we're going to hire 120 professionals, social workers, administrators, et cetera. We're going to start 3 new facilities, expand a 4th facility. And so then I'm on the phone with him, and he says, oh, are you looking at it? And I said, yeah. And he says, well, does this look like poverty pimping to you? Well, so you know what that means. And, you know, the last time I heard poverty pimping was in the 60s in Berkeley and Oakland, when the Black Panthers saw that we were starting the war on poverty. And what they said is, you know, we're willing to take care of our own families. We're willing to have our own schools, our own lunch programs, et cetera, et cetera. And you guys are starting this war on poverty, and you guys are just going to create jobs for yourselves. You guys are a bunch of poverty pimps. So it'd been 30 years later, then Jerry Brown basically says that to us. And so I'm over there. Well, I wasn't arguing with him at this point in time, because I really was questioning whether even my services were really breaking the cycle. We were helping people, but not necessarily breaking the cycle. And so we had an argument as to whose fault it was. And ultimately, he just said, look, if you could do anything you wanted to do and you didn't have to worry about money or regulations, what would you do? And you come into my office next month and show me. And so I'm over there. You know, I'd been through this in my family. I thought for about a week and a half, what would I do if I was all powerful? And I came to the conclusion that I didn't know. The thing I did know, though, is my mother got me out. So go back to Jerry's office, and he says, okay, so what would you do? And I said, well, I don't know what I would do, but, you know, my mother knew how to get me out, and I think most moms and dads would be able to know how they would get their own kids out. And so I take this money you're complaining we just spent on ourselves, I'd set some of it aside, and pay these families if they would show us what they would do to get their own kids and families out of poverty. And I had a database system back. I was an engineer. I was a bad engineer, but I was an engineer. And, I had a database system that could tell me what's happening in a family's life. And so I told them, look, I'm going to pay these families to really give me that information. We're going to see what kind of patterns and what they would do themselves. And out of that, we're bound to learn something. And he's adventurous enough to say, okay, that would be interesting. And so that was the start of the Family Independence Initiative. And it started really as an experiment to try to see what the capacity was of families to help themselves. But also what I had learned is that nobody actually is made out of poverty by themselves. And what I had been studying when I got challenged on all this is the immigrant experience and the experience of African Americans after slavery, where they built Tulsa, Harlem, more recently seeing the Mardi Gras tribes in New Orleans, Cambodians owning all the donut shops and whatever. We have a huge history of people getting out of poverty. That's what I had been studying before the war on poverty. And so I told them what we're going to do is we're going to let the families enroll in their own natural community, and then we'll watch. We'll see what they would do, and we're going to learn something. And so I had a database system, and my staff were told, we're going to meet with these groups of families, a diverse group, so we can see how this works, in the different communities, both ethnic, geographic, and whatever. And you can't say anything. So my staff was told that they would be fired if they provided any direction. And by this time, I probably should take you into some of this. I'm going to skip to here. So what we did is, in order to find out what the capacity was of families, both to take initiative on their own and to help one another, my staff was told, you have to create a vacuum of leadership. Okay? So what we would do is recruit families. They would have to self-select 5 or 6 other families. And you can kind of read that. I'm not going to take you through the whole thing. They would self-select 6, actually the most was 6 to 8 families that were friends of yours. We would enroll you as a group. You would have to get a computer. You'd have to report to us online what's happening in your family so we could track what were the different things that were helping and not helping you as you were making it out. And we'd pay you for the time that you spend in reporting to us. You'd have to meet with us once a month with our liaisons, our staff, and they would get the stories behind the data. And again, we're paying you for that time. So the liaisons, when they were sitting in these meetings at the beginning with these groups, the groups would ask them, so we know we can get paid, but what do you want us to do? And one of those groups, do you want us to buy homes? Do you want us to do? And and the liaisons are there, well, I can't tell you anything, otherwise I get fired. So there would just be this kind of silence, right? And the families are, well, whatever. And then they start talking about what they're doing already. And, to survive in these neighborhoods where schools, they do a lot to survive. They're really resourceful and resilient. So they start doing that, and they would report it to us. Down the line, what ended up happening is that the families kind of on their own after a while figured out that it wasn't direction from us. It really was their own self-initiative that really earned them the money that they spent in reporting to us. And that one of the biggest lessons I got is one of these families, Jorge and his wife, Maria Elena, was a refugee family from El Salvador. The Salvadorans all wanted to go back to El Salvador. They had been displaced there. And this one particular couple was very quiet. And one day showed up at the monthly meeting and announced they were going to buy a house. Well, the dilemma was that none of the Salvadoran families had any savings. They'd been sending all their money back to El Salvador. And some of them, well, okay. And then they said, well, all our friends are going to donate and we're going to get a down payment. And this real estate agent told us he could really help us buy this house down the street. So we're there, okay. And so they started down this process, and it started becoming pretty clear that this guy was a predatory lender. He spoke Spanish. And as the process went on, my staff is over there, there's something wrong here. Can we talk to them? Can we counsel them? Can we get them to financial training and whatever? I said, no. I promised Jerry Brown that we'd stay out of the way and we'd see. And sure enough, when they closed, their mortgage payments were 65% of their income. And we're over there, they're going to lose this house. And my staff was pissed at me. So I was like, this is really about us learning. And so you have to stay out of it. So then the next thing that happened was pretty amazing. All of a sudden, those people that had helped with the donations to get the down payment descended on this house. They re-landscaped it, repainted it, retiled it. 6 months later, they had me sit in on the refinance. They got their payments down near 40%, and it was clear that they were going to keep that house. Within 2 months of them keeping that house, the next amazing thing was that the savings line, because our data system, every month when the families report, they see the charts of what they're doing. Well, the savings line for all the Salvadoran families all of a sudden start going up. And so I talked to them, so how come you guys are saving now? And they said, well, if they can buy a house, we can buy a house. And sure enough, within a year and a half, they all bought homes. And they didn't make that same mistake. And the other amazing thing that happened, which I didn't realize, is that people outside of that group start buying houses. And the expectation within the broader Salvadoran community in that part of Oakland changed in terms of what their expectation was for success. So we start seeing homeownership have a ripple effect throughout this whole thing. If we had stopped just try to save that family, this would never have happened. We never would have learned how resourceful people really were. And you can't program for this kind of thing. So those were kind of some of the lessons. The results that we've seen with our staff staying out of it have been 5 to 10 times better than when I had case managers, social workers, et cetera, et cetera. They've been really significant. The other thing is they sustain because they own the solution. It's their solution. They developed it. And it also seems to have a ripple effect in terms of behavior or expectations for the broader community. So these are some of the results. We track 230 indicators, and I can answer some questions later. We have 230 indicators in our data tracking system, and there's patterns that we look at in terms of income. We see informal income. Nobody makes it on the $700 you get from TANF for welfare. There's a lot of other stuff going on. We get all that reports. So we start seeing all the different types of initiatives that people have. But let me take you just back a couple slides. And this goes back to my mother. So what was happening with my mother, which then I saw replicated in all these families that I've been telling you about, is that if this is the pointer, no, never mind. I'll point. My mother was here. She was working poor, and she worked really hard. She worked 2 jobs, everything. And that what she was able to do is get one kid over to here. My sister fell back in there, and now I'm dealing with the next generation of kids. Sorry. And what we have is we have 30 million households that are working poor in this country. And most of the resources right now are really set up for intervening when you're at poverty level and below. Almost everything disappears by the time you're at about 120, 130% of poverty level, which is a huge problem. What was interesting is that we found a study done by Census Bureau in 2008 that basically said, in a 3-year study that they did, 97% of the people that were here moved above the poverty level. But within 3 years, 30% were right back under. And that's what I was seeing. When I was seeing those kids show back around, it's like we put a lot of money at that back end. Almost nothing when you get people above the poverty level. We desert them at that point, which is really when they're taking the most initiative. And so we continue this cycle, and it's just not a good investment not to really continue to invest in people. And so, yes. See, I was an engineer, but you can see why I quit. The next one. If I'd stayed an engineer, people would have died. Press the one. And
then press the arrow to go forward.
Seriously, there is a slide here. I just screwed it up again. I got to go back to the thing. Tell you what. So, my mother wanted me to either be a doctor or an engineer. You can imagine if I became a doctor, it really would have been bad. I mean, we have enough trouble with me trying to be an engineer. Can I advance to... thank you. Okay, and this is kind of the ending, and then we'll take questions after the other comments, which is that what we're looking for is that we need the safety net. When my sister was getting beat up and she had to run away from her husband with 3 kids, she needed some social worker, she needed housing, she needed whatever. But as soon as she stabilized, she needed a different system that recognized her talents, her skills, her initiative. And we don't have that right now. And that right now only exists for middle and upper income. And what we need to do is really extend the kind of benefits that are available to the middle and upper income back to people that are working poor. They're amazingly productive. There's a $400 million underground economy in Oakland, California. not drugs and prostitution. These are people cutting their hair, fixing cars for everybody. We have to take advantage of that resourcefulness, that economy. So those are the pieces that we're trying to advocate for, but we're running into a lot of obstacles, and we'll be able to talk about that in a little bit. Right? Okay, thank you.
Mark, why don't you come on up and great, thank you.
Thanks, Reed. Good morning, or good afternoon, everyone. Thank you, Reed, and thank you, Maurice, and thank you to New America for sponsoring this today. I think this is going to be a really great conversation, and I actually am going to reserve some of my time so we can spend it more in conversation with one another, because I think Maurice is only skimming the surface so far. But my name is Marta Urquia, and I work at the Office of Social Innovation and Civic Participation within the Domestic Policy Council at the White House. And our office is focused on making sure that more solutions like the one that Maurice is responsible for in Oakland can spread to more communities across the country. We're interested in looking at the ways in which community solutions that are innovative and effective, and that's a very important and in that statement, can be supported and brought to scale, because we believe that in order to move the needle on some of our most pressing national challenges, it's going to require that relentless focus on results at the same time of coupling with innovative leadership and solutions to really turn things around in communities. And our office has been supportive of many efforts. We are the policy angle of social innovation, but the implementation is really happening through agencies and departments in the government. So the Social Innovation Fund at the Corporation for National and Community Service, the Investing in I3 and Race to the Top competitions at the Department of Ed. There are other competitions at HHS that are all focused on rewarding results, which is a very different way to frame funding or investments in community solutions. And it raises the bar, it raises the stakes. There's a lot of pushback on it. I'm sure those of you who've been following this, there's a tension between doing good work and then showing that you do good work in order to receive the support that's needed. But we believe that investing in what works is critical to achieving the kinds of solutions we want to see, especially at scale. In our office, we are focusing right now on 3 areas. One is around civic engagement or civic participation, so ways in which people and their ideas and their energy and their resources contribute to the solving of local problems, but also in terms of the innovation space, social impact investing and social impact bonds are 2 key areas that we're really focusing on right now. The 2012 budget has $100 billion in there for innovation through social impact bonds at 7 agencies in the government. And if you're not familiar with social impact bonds, that's a very interesting area to be following right now. There's some interesting models in the UK and in Australia, ways in which government can partner with an intermediary organization and investors to drive solutions. So an example is in the UK around recidivism, how you can lower the rate of recidivism by working with an intermediary. In the UK, this group is called Social Finance, to ask them to essentially find the providers that can help lower the recidivism rate. And the government partners with the intermediary. They choose who the providers are. They know what the outcomes, they've agreed on the outcomes, and then there's a set of investors who are paying into delivery of those outcomes. So it's a realignment of incentives. Rather than simply paying to maintain jails or prisons, we're actually driving to reduce the need for prisons. We're investing in those solutions that are specifically focused on keeping people from going back in. And so that's an example coming out of the UK. We're looking at ways in which those could be implemented or piloted in terms of the U.S., and there are some governments, state, local governments, that are looking at this independently of the federal government. New York is looking at some solutions as well. But it's an interesting area and an interesting way of thinking about redirecting funding streams, realigning incentives and priorities. And as I said, we're going forward with recommendations for this in the 2012 budget. So there's a lot of commitment on our part in terms of investing in innovation as we talk about out educating and winning the future. I think what Maurice has brought forward is an example of a community-led solution, which we know there are many, many, many of these out there. People who, like Maurice, have walked through personal experience, have seen a problem and have rallied to respond with a solution, have engaged others in the approach, and are very focused on delivering those outcomes, those results. That's something which we also support, is how do we get to being able to quantify the effects of the good work that people are doing. And it's a big challenge for the field where there isn't necessarily a consistent standard by which impact or effectiveness is measured. But it's something that we need to continue to work on and discuss and really come to agreement on what impact looks like or what results look like. I think for us, it's also looking at, how can government in partnership with various sectors support innovation, and more importantly, how can government get out of the way? Because I think when you get to the level, as Maurice has described in his essay, as the accompanying paper addresses, there are some barriers that come by way of policy or by way of how investments are historically made. So I think it's really important when we're looking at not only how do we take a good solution and scale it, but think about what are the systemic changes that need to happen so that that scale can occur, and that scale can occur not just for that solution, but for others as well. And I think the notion of innovation to be seen sort of from multiple viewpoints and angles. It can be innovation of an idea, an approach, a methodology. It doesn't necessarily mean brand new and born yesterday, but it can be a reinvention of a solution that's been in place for some time. And I think it's a good conversation that folks are having. The notion that it's innovative to think about low-income people as a consumer versus a client. I mean, that's an innovative way of approaching the work that Maurice is doing. And it's an important conversation to have, how we all can be change agents in our own lives, but in supporting the lives of others. And I think that, another piece that we're looking at is really around the alliances that need to be made, collaboration. It's, we no longer live in a time where one entity can sort of do it alone. I mean, the systems are much too complex, and the need for overhaul of those systems is pretty steep. But as we say, government can't do it alone. We're asking for collaboration and partnership with other sectors, be it the nonprofit, the philanthropic, or the business community. And that really plays out at every level, from the federal level to the state to the local. And the work that Maurice is doing, and others like Maurice, can only go so far, but for the collaboration of other entities in that same location. So to the degree that the local government is engaged, or local business, or other nonprofits, or other institutions of the community, it's really critical, because those people that Maurice is serving do not only interface with their own families and their own lives, but they interface, and with his organization, but they interface with other institutions. So whether it's the public schools, it's the access to the housing market, the realty market, et cetera. So it's very important that collaboration be a part of the solution. And as you look at the federal investments in innovation, those are investments that really promote and reward collaboration. Race to the top, I mean, that's a huge collaboration at a state level, that just the announcement of the funding drove people to recognize the need to form those alliances and redefine their behaviors, and come together as a unified solution to the problems of education in their state. And the same with investing in innovation and the Social Innovation Fund, really playing to the strengths and assets of each collaborating partner to achieve this one common goal. There's an interesting example in Ohio, the Strive initiative, many of you may have heard about. And I think that's an interesting example of collaboration and a way in which folks have been galvanized around the issue of education to respond from a funder's perspective to a local service provider, to the families, to the broader institutions or universities. And we want to see more and more and more of that, because the way that resources are right now, the need to really have a targeted direction of public and private resources is so critical. And so the standards by which those resources are directed to support good quality efforts really, really matters. And to be able to show what works is so critical. Gone are the days when you could be a charismatic leader, have a really great PR strategy for your organization and win the hearts of your local funders, and that was enough to help you get to the next level. You really have to show now that you are making a difference at a population level. What is the impact of the work that's being done? Because it is too dire in terms of the availability of resources to continue to support good programs. At the same time, not everything is a science. And clearly, the leadership behind every solution matters, and the places are all different. So San Francisco or Oakland, it's not Detroit. It's not St. Louis. Every place requires its unique solutions. But there are elements of these solutions, of these organizations and their programs that can be replicated and that can be scaled. And there's a lot to learn and a lot to share with other similar efforts. So we hope that more folks are paying attention to the work that Maurice is doing and looking at how more, they could be doing more in their own locations, but also just to think about from a funder's perspective, that there aren't these walls, say, between philanthropy and nonprofits and the private business community. We are all part of the same community together. We're all trying to achieve a common goal. How do we get there together? I would say that we can have more of a conversation about that. Our interest, again, is, to continue to spur these conversations and to move things as best we can within the federal environment, working with our different agencies and departments and really helping to keep this conversation going because it is such a critical conversation. So thank you.
Thank you, Marta. Wonderful. Okay, Mark.
Thanks very much. I greatly appreciate having the opportunity to be here. I thank Reed for his kind comments in the introduction. It's always a pleasure to come to the New America Foundation, which continues to be a steady source of new and innovative thinking across a wide range of areas. I also really appreciate having the opportunity to listen to and to hear more about the work of Maurice and the Family Independence Initiative. Maurice had come and talked with me and colleagues at ACF, the Administration for Children and Families, last year. I had heard about the Family Independence Initiative before then. There is, I think, an enormous amount that is exciting to learn about and to think about and to be challenged by from their experience. So, as indicated in my intro, I'm at the Administration for Children and Families. Let me just say a few words about ACF itself, and then focus for the rest of my comments on some of the challenges of fostering innovation and effectiveness in efforts to make a difference in addressing poverty and helping low-earning families advance and succeed. So, to say just a little bit about ACF, we're the part of HHS that's responsible for a wide range of programs affecting low-income, principally low-income children, families, and communities. Within the jurisdiction of ACF are TANF, the welfare reform effort, the Head Start program, child care, the child welfare system, the child support program, refugee assistance, energy assistance, the social service block grant, the community service block grant, the Assets for Independence program, and others. So the work within ACF is guided by a set of priority goals. And for us, those are to be addressing child poverty and family economic security, to promote child safety, to advance child and adolescent development, to reach vulnerable underserved populations, and to enhance our organizational capacity to make a difference in these programs, to make them more effective, and to promote the integrity of these programs. So in doing all this, we are guided by a commitment to interoperability. I wish there was a better term to use for that. But by interoperability, we mean the goal of breaking down silos in all these programs, recognizing that they are working towards common goals, but too often working separate and apart from each other. So towards an effort to have them move towards common goals and to make it easier for states and tribes and other grantees to coordinate the programs, to have integrated agendas in what they do. we're also very much guided by the administration's strong priority on ensuring that we use and that we encourage the grantees at ACF to use the strongest available research and evidence-based practices in their operations. So in these programs, one thing to emphasize, and it presents a challenge for the federal role, is that in virtually all of these, the federal government doesn't directly deliver services. Instead, it provides funds to states or tribes, local grantees, sometimes nonprofit organizations, sometimes governments. In providing the funding, sometimes this is done with lots of requirements, sometimes with few requirements, but ultimately the grantees are responsible for operating the programs. And that does wind up having important implications for thinking about the federal role in fostering innovation and in measuring effectiveness, because it presents a whole set of choices, sometimes made by Congress, sometimes delegated by Congress to us, about how to strike the balance between federal prescription and flexibility in the program operation. Whether to be specifying the strategies that grantees are to be using or the outcomes that they should be seeking to attain. What the nature of reporting looks like, what the nature of accountability needs to look like, whether to be trying to affect their behavior through bonuses, through penalties, through both, through neither. All those are issues. So Maurice's his experience, his comments this morning, and the papers that both Maurice and the companion paper describe, and which I'd recommend reading for more thoughts and insights on this, do present, I think, a set of challenges for us both in and outside of government in asking about how we decide whether current approaches are effective, in a world of very limited resources, how we can make judgments about both how they can be approved and whether there's something else out there which is a different approach, suggests a different paradigm that might be more effective than things that we're currently doing. In the set of things Maurice talks about, I think there are pieces of it that probably a number of states, if they were here, would agree with. Certainly not everything. But I think that there are, for example, aspects such as saying it's important to operate from a strengths-based framework rather than focusing on deficits, that it's better to be taking a whole family approach instead of focusing narrowly on individuals. It's better to be comprehensive and flexible instead of being rigidly defined and taking a one-size-fits-all approach. This doesn't always happen in practice, but I think as a matter of principle, people would often say this is how they aspire to proceed. There is also, I'd say, in a number of places around the country, considerable interest in the potential role of incentive-based approaches. This was most recently tested in New York City's conditional cash transfer initiative that had been inspired by the efforts in Mexico and elsewhere around cash transfers as a means of encouraging a set of behaviors from families. And it was very much guided by the premise that families didn't need case managers, didn't need extensive engagement from workers, but could largely be motivated by their own efforts in an incentive-based framework. There is, I think, a lot of interest in the incentive, the potential role of incentives in some of the research at ACF, where we're looking at career pathways initiatives. We're particularly wanting to also understand roles incentives may play, potential roles that some of the findings from behavioral economics can play in thinking about this. Having said this, I mean, what does seem to me to be most distinctive about Maurice's approach is what Marta referred to as the consumer versus client perspective, the focus on recognizing the essential role of the family and of the individual in making their own choices, and in particular, I would say, blending that with the essential role of the peer group and a community support network and the potential strengths from being part of such a network. I think that there is much that is powerful and compelling in that presentation. This is an area where we don't have, at least when we look about rigorous research, we don't have as much rigorous research around looking at it. But for people who do work in communities, I suspect that there will be a great deal that rings very true in Maurice's description. We certainly do have at least some research about the importance of social capital and social networks in helping people in finding employment, in addressing children's needs, in addressing urgent short-term needs, and in efforts around asset buildings. I think we probably know less about the role of government in supporting efforts like this, and the questions of when the appropriate role is to support, when the appropriate role is to get out of the way, how to spur and strengthen social networks that aren't already in place. And from that standpoint, there's much that we could be learning from the Family Independence Initiative and other efforts. At the same time, I do need to make just the obvious cautions from an evidence-based perspective that when we look at results from this initiative, or indeed many that we might hear about, we have to keep in mind that outcomes aren't the same as impacts, that they depend in part on the characteristics of who's participating in the program, that people, or the initiative, that people who are participating may not be the same as people who aren't participating, and the very point that one size fits all has its limitations, suggests the need to be thinking about multiple strategies. I'd note in particular that it seems to me that a particular consideration here is thinking hard about the questions of substitution versus complementarity. That when are the circumstances where initiatives such as the one that Maurice and his colleagues are operating can in fact substitute for things that government currently does? When are the instances in which we really want to think of them in complementary terms? That it is surely the case that a social network may be extremely effective in helping someone find a job when they're between jobs. They may, in fact, be helpful in a family or an individual trying to think about, so what do I want to do next, and where do I want to go in the labor market? When it comes time to actually say, so I want to be in this training program, ultimately somebody has to deliver the training program. So thinking about the complementary nature. Similarly, in an area such as childcare, a network such as this could play an important role in providing backup childcare, in helping people understand what's available in the community, what good experiences there have been, what are all the issues a family faces when they place their child in childcare. At the same time, it's not playing the same role as operating a Head Start program or a high-quality childcare program. So I think throughout we want to think carefully about the substitution and the complementary aspects of things. Let me just say in closing, I also think that one of the striking things in hearing Maurice's comments and in his paper is the potential role for making much greater use of competition amongst providers, and the potential role of choice by families, and the ways in which that can both empower individuals, send important cues about which providers are performing better, help us think about market share issues, and help us think about who needs to be rewarded and how we can learn from the experience of the providers that are most effective. The potential both for the use of social networks and social media in having people be able to communicate their experiences and have others learn from those experiences is potentially quite important. The administration is very focused on the potential of greater use of competition as a means of identifying higher performers and learning from those performers. So let me close by just saying that it is tremendously both interesting and challenging to hear Maurice's comments, his experience. I do think that it suggests a whole range of questions for a dialogue about how we can do better and build on innovation, and I greatly look forward to continuing it both today and after today. Thanks.
Great. Thank you, Mark.
Great. Okay, there's a lot there, both in Maurice's remarks and also by Marta's and Mark's comments. So we kind of want to give you a chance to respond to some of those issues and open up for a broader discussion here. And I guess really a lot there to respond to. But let me just start you off by asking, what actually more do you want to learn about the experience to date? I mean, where do you think some of your knowledge needs to be filled in to then begin addressing some of the issues that Mark raised, for instance?
You had to ask me a hard question. I think for us, when I first started this work, I came out of the nonprofit sector after I left engineering. And what I learned is that when I ran social services is that I was constantly trying to get money, trying to get funding, and that's what drove everything. And I came to learn that foundations and government really set the table in terms of what I would do. So if foundations and government were asking me what the need is, what service to provide, then I came up with needs and services. And so ultimately what we've decided is that what we need to do is engage in conversations like this. So if I was to move forward, really what we want to do is go to people that really are controlling money and have the most influence. Because what we really need to do is be able to, sort of like what Mark said, look at this population of 30 million households as consumers. And then how do we fill that market niche? But if we're the ones that have control over some of the resources and some of the opportunities, then how do we make that available to that marketplace?
Yeah. The other thing I'd like you to react to is a little bit about the way you've reimagined the case management model and how that process has gone, and specifically about how you're responding to the needs of gathering information about what's happening, that obviously both from some of the partners that might be involved in this effort, government or others, have as requirements that they are part of that process of collecting information and reporting and accountability. How have you seen that work, and what's next?
It hits kind of two big realms. On the case management piece, I had 120 staff when I ran my nonprofit. I had case managers, social workers, employment specialists, you name it. And what I found is that when we tried it without any of them, that the families in many ways provided better expertise in counseling than I ever could. They were friends, they were culturally relevant, they had often had the same bad experiences, but what was interesting is that I learned that, and sort of like my mother, even though you were in this very low-income, isolated community, one of our families, their mother is a real estate agent and whatever, and that when you'd get in trouble, some people had solved problems, so that there were strengths within your social networks, and that in many ways, when you shared that with somebody that got in trouble into the same thing, that experience of somebody you could relate to, explaining to you how to get through it and how to manage it and whatever, they did a much better job than when I had case managers. I had social workers that were in their mid to late 20s that had really not experienced anything, trying to counsel a family that had been through refugee camps, survived everything, came to this land without any language, figured out how to get a job, and amazingly resourceful people. And I had a 28-year-old trying to counsel them. It didn't make any sense. And yet that's the only thing I could get funding for. I really couldn't get it from. So that touches on the not just government, but funders. And that funding, actually the way it's set up, often requires case managers. And the dilemma is that when a funder requires it, then you really try to provide that. And ultimately, it does tend to undermine. And I'd have to say that I felt that at a certain point, I was actually doing harm, which is sort of the first tenet of this work, is don't do harm.
And I wanted to ask kind of Mark and Marta to weigh in here as well, and maybe kind of both identified some of the trade-offs and multi-objectives between prescription and flexibility. And how do you see that kind of playing out in the current environment, both with as the Social Innovation Fund is kind of looking to identify good work and promise out there, but also Mark is kind of overseeing a broad array of programs that kind of have their requirements, and how do we see that being that some of that tension being played out in future times here?
So I think that it's an important tension, prescription versus encouraging bottom-up solutions, right? So I think what we could say is that the administration has a point of view and has placed a high value, a premium on innovation, right? But the federal government, as Mark was saying, there are a lot of things that the federal government or government in general does or doesn't do and does or doesn't do well. So the federal government in and of itself isn't the innovator, but what we have is the ability to direct resources towards those that are and that are effective innovators. So we can say that in the case of the Social Innovation Fund, what is being sought, which is effective solutions in the areas of healthy futures, youth development and school support, or economic opportunity, or in the case of I3 and Race to the Top, it's effectiveness in the areas of education around classroom reform, et cetera, and then hold people to that standard. And so we're not telling them how to do it. We're not saying this is the program, this is the model, this is the approach, but you have to demonstrate a track record and an ability to get things done. With the Social Innovation Fund, it's about identifying intermediary organizations that can source the local innovations or the local community solutions and making them that grant maker to the local community. And yet there are programs that do require some direction, because we do have programs that are backed by evidence and research, and we know that that's the approach that will generate the outcome that's desired. And so it's not an either or. I think it's a both and I think that there is a segment of the population, for example, in the work that Maurice talks about, that can do what Maurice sets up, can function in an environment like that. It's absolutely, it's who they are, it's what they do, to be able to make choices every day. I mean, if anybody's making choices, I think low-income people are making a lot of choices every single day. But there are folks who are in situations where they are challenged in ways in which they can't decide for themselves. There may be mental health challenges. There are programs that require more of a handheld experience and programs that don't. And I think the unleashing of choice is a common theme. It's something that, we've seen in the charter school movement. It's something that we're saying in, these innovation funds is come forward with the solutions. We're not telling you how to do it or, to do it in the first place. We know that you're already hard at work, and so bring it forward, let it be known, let it be seen, and if it merits the funding, it will get it.
Yeah. Mark?
Sure. Some of the programs that we administer are ones where they are grant programs and entities apply for the grants and we can choose the grantees. A number of them, and often where the largest amount of money is involved, will be ones where funds go to states, or in the case of the Head Start program, to grantees who are long established. In the situation where funds are going to states, I mean, as you can readily imagine, the disputes about how to strike the balance between outcomes and prescription are intense disputes. They typically get fought out in the legislative process. They typically wind up with some set of either compromises or somebody winning as to where the balance gets struck. And then for those of us involved in administration, we often face a structure where we need to proceed in light of the decisions that Congress has made. So that very often means that an important aspect of trying to foster innovation involves the research agenda, the technical assistance agenda, the pointing to best practices, efforts to try to foster conversations, both horizontal and vertical, about experiences and learning and interesting things people are doing that seem promising that'd be good for others to know about. and that becomes much of the process. As Marta indicated, there are some examples, and there were a couple of striking ones by Congress in last year around both teen pregnancy and home visiting, where in both instances the determination was there actually is a strong enough research base about things which have been established to be effective that in structuring a program it makes sense to say that most of the money needs to go to things which have been determined to be effective through research, while at the same time ensuring that some of the funds can be used for innovation in a context where there is a commitment to evaluate the innovations. Certainly one of the issues that people will face over time is that with any innovation there's a question of what's the point at which evaluation is appropriate. There is a big learning startup period. It is also the case that for some of the most innovative organizations, it's not really the situation that they reach a stable state where they're doing the same thing. They're continuously innovating, and the program 3 years from now is going to look different than it looks today, and that poses a set of issues around evaluation. So I believe the short answer is it depends, but I think what it does mean is that there's not necessarily a single way to go across all programs. It very much does depend upon the nature of the grantees, the nature of the federal-state relationship, what's known about the relevant research base, and this continuing tension really between innovation and building on what's already been done.
Yeah, very helpful. Okay, we're going to open it up now to questions from the floor. There'll be a mic going around. I'll call on you. You'll tell me who you are. You'll say where you're from maybe, and then you'll ask a question directly, shortly, to one of the panelists up here. So we'll do that. But before we do think of your questions now, I did want to ask Maurice something. You said pay the families as something that you think of as how this model was kind of unfolding. Mark mentioned in his remarks the concept of conditional cash transfers, where there's a certain behavior that is identified that we think other people think might be positive, that you're kind of paying for specific outcomes. And there's a body of work and research that's being collected around that I think is quite interesting and promising, and we've been trying to follow and promote here at the New America Foundation. And do you see the conditional cash transfer analogy as part of this, or is that really actually in tension with your approach, since you're not trying to presuppose specific outcomes?
Great question. Because I think a lot of times our work is characterized as a conditional cash transfer, and I don't see it that way. The way we look at families and where I came from is that the biggest distinction, other than the people in crisis, like you said, there are people that get in crisis, middle and upper income people get in crisis too, that the biggest distinction between the low-income communities and the rest of us that are middle and upper income is that they have less money and they aren't in the social networks that have all the opportunities. But in terms of resourcefulness, that it really is there. The difficulty I have with cash transfers is that it presupposes that families really don't know what's the right thing to do. I hated the library card thing. It's like, that they were incentivizing a library card as if somebody wouldn't think of that if they really felt that was the most important thing next to paying your electricity bill. So, those types of stereotypes that kind of got perpetuated I didn't like. What I really did like about it is that it did transfer cash to these families. And ultimately, they would use those dollars the way they felt was really important, and they needed those dollars. So I do think it unleashes other pieces of it. But right now, almost all the evaluation is really on the cash transfer piece as being the incentive, as opposed to having the extra funding and whatever creates more creativity and innovation within the family itself.
Yeah,
which is more what we're really looking at.
Right. But actually, there is some overlap between some of the goals that the Families and Family Independence Initiative have identified and what some of the
So we don't take issue with them, other than the stereotype it kind of still tends to promote.
Okay, great. Thank you. Let's start right behind you there, Rachel. Bob?
I'm Steve Schafferman with the U.S. Basic Income Guarantee Network, and we're exploring ideas about unconditional cash transfers. As you may know, in the 1960s, it was a mainstream moderate idea that there ought to be some type of guaranteed income, and similar programs are gaining a lot of momentum in many other countries, Brazil, South Africa, Ireland, elsewhere. So you've sort of started to answer my question just a moment ago, and I want to thank you for that, and thank you for providing answers also to some of the questions that I'm often hearing, which are based on the stereotypes. So if you could just comment more about the value of unconditional cash transfers and what you think might happen if we were to give all poor people, say, expanding the earned income tax credit or even going beyond that.
On my perspective, so much of what we're trying to do is break down kind of the, not just the stereotypes, but sort of the distinction that's being made between kind of us and them. And so the reason that you saw that line drawn kind of like the rich folks, the rich folks get a lot of money. And, that right now, if you're lower income, that you don't get very much unless you get into welfare and whatever, and then there is a system there. And the reason we drew the line the way we did, and EITC could really be part of that line, is that what we're trying to do is, once my sister really was taking the initiative to get her life together, she didn't want to be seen as, quote, poor. She didn't want to be seen as, having to be thought of as special or a charity case. It was the same thing with my mother. And that what people that are trying to get their lives together want to be included in society the way the rest of us are. And the fact is we do incent middle and upper income. There's $367 billion set aside for asset building for middle and upper income. So there are those issues, and that what we want to do is include the populations that are really taking a lot of initiative to be included in that system. So, I don't have issue with what you're trying to do. I actually think those are really important things. I would try to make sure that it was really a way to rebuild the connections between all of us. Would be the only thing.
Okay, let me see your other hand. So I'll go with Catherine and then Richie.
If you guys have comments.
Hi, Catherine Kravitz. There's some research, I believe, that effectiveness, that from a cost-effective standpoint, it's better to put resources into people who are the most dysfunctional, and that a lot, or families that are the most intensely needy, because other people seem to be able to find their way out on their own. And I wonder, addressing to any of you, but Mark in particular, whether you find that in the child poverty area, and whether you're taking that into consideration from a cost-effectiveness standpoint, especially in this time of budget cuts.
So, I wouldn't actually describe that as a general principle or as a general finding from the research. There is in ACF, we rely heavily on experimental findings from random assignment studies where there's an experimental group and a control group, and you measure the impact of a particular initiative by looking at the difference between the two. There really are a range of findings, but one of the frequent findings often, and sometimes a frustrating finding, is that a particular initiative has its greatest impact with the middle group. There's lots of issues about how do you define the middle group, but basically the point is that people who had the greatest capacity could accomplish whatever was the thing that's being measured without the program. People who had the greatest problems were sometimes not helped or not helped very much by the program, and that a group somewhere between the two wound up showing an impact. So that finding does appear sometimes, but again, I wouldn't universalize this at all. What I would say, answering you somewhat more broadly, is that in a strongly evidence-based administration, we are seeking to make use of experimental findings whenever they are based on high-quality studies and provide guidance for policy. It's not always the case that you have a sufficient experimental base for moving forward, and the issues of the most effective use of evidence-based policy then call for looking at a range of evidences.
Yeah. Okay, Rachel, right here on the aisle. Okay. Who else? Let me see.
Hi, I'm Lauren Hogan. I'm the Director of Policy for the National Black Child Development Institute. And actually 6 years ago, I spent a month in Oakland talking with Maurice's staff and families writing my master's thesis on the Family Independence Initiative. So I was actually wondering, we've been talking about this a little bit, and it's actually the first question that the researchers ask in their paper about, are there certain types of families that sort of benefit from this initiative? And I was wondering about Maurice's perspective on sort of aside from the difference of they're poorer and they have fewer resources, you guys collect a ton of data. Do you actually think that there are characteristics both of families and of the affinity groups, which function very differently, that sort of define whether or not people are able to take advantage of these programs?
Great question. Yeah.
It's an amazing question.
I want to know the answer to that, too.
Okay, so it's actually, I can answer it really simply. It depends.
Right.
It's sort of like where Mark is at. People are people, middle, upper, low income, and whatever. There's a huge diversity. And though I'll answer this more in terms of, for middle and upper income, we have a huge diversity. Now that I'm middle income, I wasn't middle income all the time, but now that I've learned how it is to be middle, upper income, then there's a huge diversity in what we need in our populations and capacities, even within the family. My kids are all different and whatever. And that the way our system deals with it is that they make available services when we need them. If I need a financial planner, I'll buy it. I'm the consumer, therefore I'll buy it. And there's times when I bought my first house, I had no idea how to buy a house, but I bought a house because I got a real estate agent and they knew how to do the whole thing. But when I run these my programs, I used to have to run low-income families through financial training. It made no sense that I really didn't know anything and I didn't have to go through financial training, because I had some money, but I would run low-income families through that kind of thing. What we're really pushing for is to have this country make available the range of choices and benefits that are available to middle and upper income and connect the two populations, quit trying to make that distinction, and have it be more consumer driven. It is a huge economy. It is a huge set of resourcefulness, and we really need to, services actually play only about a 10% role in families' lives. Somebody else, I think Marta was saying they deal with their employers, their church, all of these things, whatever, and a family's dealing with all those things all of the time. So in terms of our intervention, we're trying to prove that that capacity is there in these communities and that it actually can work to scale if you go through natural community friends. And so we had a ripple effect of hundreds of people all of a sudden showing up wanting to enroll because they heard the first 16 families were able to do it their way. So that's how the Irish got out. That's how African Americans built Tulsa. That's sort of a natural process. So the thing would be that this country really adds the kind of diversity. Quit trying to come up with a program to try to do that. You can't institutionalize these things. You need a ton of different programs. And we need to be more data-driven and consumer-driven. Those are the pieces that need to happen. We focused on starting with families that were around poverty level, just to prove the point. We knew we couldn't start with families in crisis, because that's what the safety net's supposed to be for. But we'd start near poverty level, and 40% of our families are below poverty. But they're struggling. They're trying to do something, not in crisis, and others are above poverty level. But it was really to prove the point. In Hawaii, where we tried this, there was one group that could have advanced using at least the payments that we made and the access that we had. They could have used it really well to advance. They already had connections to Japan to try to build their farms and whatever. And we turned them down, mostly not because they couldn't be helped by the type of diversity and ways of earning that we were promoting, but because they wouldn't prove our point that in humanity, at the lowest capacity, there is capacity, but we've stereotyped it away. So I hope that kind of answers.
Interesting. Yeah, David, then we'll go to you.
Yeah, the question has
Wait for the mic.
Case
Thank you.
management. Actually, we've institutionalized this for a number of decades through the welfare bureaucracy, the welfare department, and its contractees. And the question is prompted by Marta's observation that we could charter public schools. And my question would be, if we can charter public schools and generate some innovation, diversity, and relevance to low-income people, why don't we charter welfare departments and essentially cash out the welfare bureaucracy in favor of financial services and benefits that are actually apropos of their circumstances?
You're asking me?
Yeah,
I
anyone
turn to
can
them.
comment.
I run this thing out in the community. No, I mean, something like that I think is fascinating. It's true. Why don't we really look at the system? One of the things we're saying is that people do need resources. And it does depend. We have to make some assessment as to when can you use a case manager and when is that really superfluous and it actually undermines the initiative. And that determination does need to happen. And I think it does fall on funders and policy people to look at how that distinction can be made. But that type of idea, I think, given the administration's looking for innovation and different types of solutions, I don't know.
And yet we don't want to abandon what works if there is something in there in that infrastructure. Although it's a compelling idea.
It's a compelling idea.
Anything?
Well, just an observation. So in TANF, the block grant that goes to states for what was referred to for the old welfare system when it was when it went through the big changes in '96. So in that, there actually isn't a requirement that the state administer the program or that the county administer the program. It is possible to contract out to have other entities do so. So I'm thinking, for example, in Wisconsin, there was a contracting out, and in the city of Milwaukee, different agencies wound up having responsibility for different parts of the city. What does emerge in that setting? I mean, it's a challenge with public agencies too. Are the issues about what do you write into the contract? What do you require? What do you leave for them? How do you measure the effectiveness of what they're doing? I mean, all of those issues do arise. The other thing that I'd note, I mean, which becomes another issue around trying to move to a more competitive model is, I think the type of thing that Maurice I think is envisioning is sort of true competition where there's multiple providers within an area and you pick the one you want. That's very different from a structure that says there will be competition for who gets the contract for this service area. So those are two very different meanings to competition.
I think I'll add a little bit to that. That's a really important distinction for us, and that because of the feedback we were getting from the families as to certain programs seem to work for some people and not for other people, et cetera, and they were starting to tell each other, because there's a lot of storytelling that we pick up the stories, that on our data tracking system, they go on every month and report on these 230 data points. That one of them is when they report they've been to a child care center or whatever, now there's a 5-star rating system, and they rate that program in terms of 1 star, 5 stars, and the comments about it. And the first reason was that they wanted to tell each other. It's sort of like Yelp. I don't know if Yelp is in D.C., but those types of things where we look for restaurants and whatever, and we want to know people's opinions. The other thing is the mayor in Boston said he's got 146 nonprofits in a 2-mile radius, and he doesn't know really from the consumer side what works and doesn't work. And he was curious as to what the people thought. So the technology nowadays, we're building a whole social media piece onto this whole thing. The technology's there now to get consumer feedback. And that's actually one of the things that we're pushing for Governor Brown to put into California.
Mm-hmm. All right, let's keep moving here. Start with you, and we'll go back.
I'm Sandy Ambrosi with the Kresge Foundation. I've been hearing a lot about the cuts, and that we're going to primarily have to cut to balance our budget. I've also been hearing a lot about evidence-based programming, And I guess I'd like to hear whether or not, to what extent are the findings from evidence-based programs really informing those cuts? And if not, how can we, representing the philanthropic sector, make that more part of the discussion? And if it is part of the discussion, what do you need more of?
Yeah. And let me extend that a little bit to the Social Innovation Fund process that Marta might have some insight on, about how that actually, not about cuts, but how it led to kind of affirmation of some ideas that came forward.
Yeah, I think that, you know, the there's such a and Mark too can chime in on the evidence piece. I mean, it's clear that there is a need for more evidence, and that there are areas where evidence is showing impact, and we want to continue that. I mean, these models of the Teen Mom program and their home visitation model at HHS are, you know, the universe of evidence is so small, and it's very clear. It doesn't rule out that there aren't other effective models, and in fact, groups are encouraged in different federal grant areas to put forward if they think that they have a model that is effective, but it's not there on the list already, to put that forward. So I think that, you know, on the one hand is continuing to build this evidence base. So where there are investments in innovation funds, you know, those funds are just like a year into their operations, if even that. To get to the evidence of those, there's still a way to go. And some of those are funds that are in the authorization. There's a time set in it, so it's going to be for 5 years, it's et cetera, and it becomes a decision around, you know, appropriations every year, whether the funds will be appropriated, but the legislation sets that fund up to last for X period of time. So there's a lot of different factors into this. In terms of the 2012 budget, I think that there are clear indications of continuing to invest in areas where the evidence base can continue to be built, where, you know, community solutions like the kind that Maurice is here presenting today will continue to have an opportunity to receive federal support. So you can see that the investments made in the areas of innovation are there for experimentation around, as I described, the social impact bond model, which is called Pay for Success, you know, rewarding performance, you know, continuing to just create that environment or maintain that space open for those programs to rise to the surface, to be seen as potential opportunities for growth and investment. But we do have a lot of cuts that we're balancing at the same time. I don't think that means, you know, it's a one or the other kind of choice that was made, and I think that this administration has been looking very closely at where evidence is showing a difference and is, you know, showing an impact, or the desired outcomes are being achieved, and wherever possible to be able to sustain those. But I think in general, the onus is on community solutions to show their worth and to show that they are achieving results and achieving impact. I don't think there's any getting away from that.
Mm-hmm. Mark, insights into the budget process here?
Well, just to briefly add, what I would say is that for us in the process of developing our budget for 2012 and in the back and forth with OMB, the Office of Management and Budget in that process, issues around evidence and effectiveness and information about the effectiveness of programs were very, very prominent in the exchanges and in developing the budget. You know, at the same time, it is certainly the case that for a large number of programs, you know, there are always places where you wish you knew more, and where there's some things you can tell from rigorous experimentation. There are areas where there isn't any. There are some where the data helps you tell you a story. There is some where the data is much thinner than you would like. And I do think the overall one of the overall challenges before us is how we improve that process over time so that it can be a more informed structure.
Yeah, isn't that true of the defense budget as well? Should we be asking the same questions over there? You don't have to answer that. Okay, we're going to just take a few more stacked up here, and tell me your questions, and then we'll let the panelists have kind of final remarks. So we'll start in the back. We'll go here, and then saw another hand right over here. There you go. So 1, 2, 3. Thank you.
Hi, I'm Cecilio Morales from the Employment Training Reporter, and I came to hear about solutions for a new war on poverty, and I maybe have seen not even a scuffle of playing the dozens with poverty here. Is there, I want to hear from the administration people here, is there going to be a new war on poverty? Poverty did go up, and what does that consist of? Is it this social funding innovation, and is it that which is 100 million or billion? I didn't get that clear.
Million. Yeah.
Okay.
Thank you. And of course, the title was ours and not theirs. Yes, right here.
Thank you. Bruce McGlory, formerly Brookings and a friend of Maurice's.
Good.
Factual question, Maurice. When and why and how do family or family groups leave the oversight or the reporting from FII? And do you have any tracking to know whether simply the reporting makes a difference in their behavior before, while they're reporting, and after they've left? Second, a frivolous question. We have a whole new definition of social networks in this country, Facebook being a case in point. Is there any way that you can use the new social networks to advantage in what you're doing?
Great question. Okay, and finally up front here. Thank you.
John Shimano with the American Humane Association, and I guess my question is to do with TANF, since it's the biggest thing on the table in terms of the reauthorization, $16.5 billion, and states do have some flexibility. They have since 1996, as Mark pointed out, I guess. So the question is, in that reauthorization, if it should happen, what would be the changes, or this strengthening it, or altering it?
Great, thank you. Can you handle some of those stacked up together, Maurice? And Marta and Mark can make final comments as well.
Sure. On the new war on poverty, I would certainly hope that there'll be a new war on poverty, but that a major impetus for that would come from the families themselves. When I talk with families, I tell them, there's been a 40-year war on poverty with some of the smartest people in the country with resources, and they haven't figured out how to help you, and it's going to be up to you. And you're going to need to lead this, and you can't have me sitting up here at these things talking to you. So I'm hoping in a few years they'll be sitting here talking to you. So that piece, I think, that's what I'm looking forward to. That's one of the pieces. Certainly, I think that government and people, like this, are the ones that need to work together with our families to make a difference. So it's that coalition I think is important. And hopefully we'll get a new war on poverty. Not the old one.
So while we're on it, should we go ahead?
Yes, go ahead. Go on that one.
So I think it's important to note, the funding streams I've described are not all the funding streams that are investing in. I don't know.
Just grab this one.
Yeah, the funding streams that I described earlier are not all the funding streams that are going into communities. So this by no means representative of where the investments are. What I think is important to note about them is that they're specifically targeted around areas of, most pressing social problems, and looking at ways to move the needle where, we all know the needle, as Maurice just said, has not moved significantly in decades. And a big challenge around that has been really putting resources into programs that are actually effective. So in many ways, what the innovation funds across the government are attempting to do is to really get to that effectiveness question to see where impact can be achieved and to continue to support that. So I think that is important so that we can see more of these solutions that are coming up with innovative responses and approaches to poverty. I think, we're talking about investments in an infrastructure that can sustain people not just today and tomorrow, but down the road. And so if it's an overhaul in terms of our education systems, if it's a different way of communities coming together to tackle a problem, then that's what needs to happen, because the reform of things as complex as educational systems, that's not going to happen without the kinds of solutions that bring forward collaboration, that bring forward the ownership of people themselves who are relying on these public services So we're hoping through the Social Innovation Office, the funds that are targeting social problems, that we can get to more of those. But by no means is that a full picture of what's happening across the administration.
The couple of things I'd add. As I know everybody appreciates, we face a tremendously serious deficit and debt situation for the nation that is having a dramatic effect on what the choices being made by Congress, the choices by the administration in its budget. There is little doubt that the decisions that are made in a time of a deficit of this magnitude are different than the choices that would be made at a different time. At the same time, that does mean for all of us that the issues about looking at effectiveness and how to make programs operate better and how to spur innovation become even more urgent. And that's a big part of why you're hearing the emphasis in the discussion here today. Just quickly on the TANF side, I would note that it's ultimately up to Congress whether it takes up reauthorization this year. If it does choose to do so, we've particularly highlighted the need to look at what has been a strikingly positive experience around use of subsidized employment around the country, the need for a structure that's more responsive in times of economic downturn, and the need for a structure that looks at program outcomes and doesn't just measure process.
Thank you. On the leaving tracking, social media?
Yeah, so on those, we did come back to the Oakland families and did a post-survey about 2-3 years after they had left our project. And what we found is that, this is all pre-recession, we had found that the families continued on this upward trend. Their income, I think 2 or 3 years down the line, was up 60% from what it had been when they first enrolled at baseline. But it wasn't their income. What was really fascinating is their sense of control over their lives, the sense of how they were going after and demanding different choices was really clear. And it was that change in behavior and expectation, which is like when we raise our teenagers, we want them to have high expectations, and we have high expectations, that sense of expectation and whatever was really what was driving this whole thing. And there's a lot of behavioral studies that kind of indicate that it would sustain once people feel like they're in control of their lives. On the second piece, in terms of whether the reporting has an impact, it turned out I was paying the families because I thought it was intrusive to ask them, 230 data points. And as it turned out, when they reported back, we just had an evaluation finished again, and they reported back that the data system was one of the biggest change agents. You'll hear Tamara on our website talking about how before, surviving was a day-to-day thing, and she couldn't, reflect or really try to focus. But once she was reporting every month, she could see, my debt's going down, I'm doing this and whatever. People have kind of made it akin to like Weight Watchers. I never have been through Weight Watchers, but I guess you have feedback and whatever, and it really is a positive reinforcement or whatever it tells you. So the data system and collecting the data, families want the kind of data that we talk about all the time. We should be telling them all the stuff that we know and get their opinions about it. Data makes a huge difference to them. And the last piece on social media is it's huge. So we're starting social media into our site now. They have a lot of opinions that they want to share with each other. There's families in San Francisco now are going to be flying to Boston to talk to the families we've engaged in Boston. There's the families in New Orleans that want to talk to them. That cross-sector means that we don't have to hire staff. They orient one another. And we jumped from, our enrollment jumped 400% when that evaluation was done. It's on our website. And our costs dropped 300% in that same period because they were taking care of each other. So we don't hire staff. You nominate somebody to come in. You then orient them. You teach them how to do the reporting, and you're their counselor. It works much better.
Yeah, thank you very much, Maurice and Mark and Marta, for your comments and participation. I feel like there's a lot more to learn here, and we're going to stay tuned. We certainly invite you all to look at the papers that are online at newamerica.net by Maurice and our colleagues Ann Stuhldreher and Rook O'Brien. Very, very interesting pieces looking at the policy implications. Thank you for your time, and thank you all for your time participating as well. Cheers.